It's October the 29th, 2025, and that is World Stroke Day. I am Dr. Wolf, and I am a pathologist, and I want to talk about stroke a little bit in this video so that you can be aware of the symptoms and recognize them in yourself or recognize them in someone you know who may be having a stroke. So first, what is stroke exactly? This is when you have blood flow that is interrupted to a part of the brain. Basically we have our vascular system where we have the heart. Blood is pumping through the carotid arteries and the vertebral arteries up to the base of the brain in a structure called the circle of Willis. And then from there, the main vessels of the brain spread out over to nourish the entire brain. And if there is a blockage in those vessels, in one or more of those vessels, this can produce an ischemic stroke where it is blocked. It is physically not getting through. Now, on the other hand, there can be a hemorrhage, a rupture of an aneurysm, or some other reason like very high blood pressure can rupture. And what that does is it also produces a decrease in blood flow to an area of the brain. The issue is with brain is that it is a very soft, very delicate and fragile tissue. So the saying that goes along with this is time is brain, meaning the longer the time goes where the blood is not getting to where it needs to be, the more likely you're going to have death of that brain tissue. And of course, that is problematic because we don't regenerate brain tissue. So some of the symptoms that can go along with a diagnosis of stroke would be like loss of function, loss of muscular function in some part of your body. You might see that as drooping of one side of the face, muscular weakness in the hands, arms, legs, or other area of the body. Also, you can see confusion, fatigue, loss of vision in one or both eyes. In the case of hemorrhagic strokes, like where you have a rupture aneurysm or ruptured arteriovenous malformation or something, you're going to have a sudden, very severe headache. In fact, it's usually referred to as the worst headache of one's life. And then other kind of non-specific symptoms like loss of balance and coordination. So there are other conditions that can have stroke-like symptoms, such as transient ischemic attack or a TIA, which is stroke-like symptoms that maybe aren't as severe, and when you do the imaging and the testing, you don't see the evidence of stroke, and then it can go away after a short amount of time. Also, there are things like ocular migraines, where it's a type of migraine where you lose your vision, or maybe you become extremely fatigued, or have some kind of neurologic deficit. And there are a number of conditions that can do that. The problem is when you have stroke-like symptoms, you have to have it evaluated. Now, while we think of stroke occurring most commonly in older people, and certainly it is most commonly in older people, it can occur in essentially any age. It can happen in the young, it can happen in the middle age, the old age, and so that's why you have to be aware of these symptoms. And as I said earlier, the longer you wait for medical care, time is brain, the less likely they are going to be able to help you prevent that stroke from getting any worse. Now, this, of course, is not an exhaustive overview of stroke. This is really just bullet points. I want you to hear those symptoms. I want you to be aware for yourself and for those around you. And I also want to just give the pathologic perspective that I see. Of course, I see both kinds of these strokes when I do my autopsy cases. Sometimes people die of stroke and I see it, and other times they die of other conditions and I might see that they've had a stroke. The reason why the stroke is so dangerous, you can see it physically when you touch a brain, when you are looking at a brain. A brain is the consistency roughly of Jell-O, okay? Some people have compared it to a soft cheese or butter that's been sitting out on the counter for 10 minutes. So there's a lot of different ways to describe it. The point is something that's so extremely soft, that has such a delicate architecture. When you interrupt that blood supply, it starts to die very easily. And once that tissue is gone, it's very hard to maintain function for whatever area that has been affected. So I hope this was helpful. I know a lot of my followers, you already know about this, but this is for people who might be scrolling and they are just interested to know a little bit more about stroke. And hopefully, if just one person learns something today, it might save a life. It might save disability for somebody who's having a stroke.